Sure. My name is Neil Docherty. I'm from University College Dublin, from the School of Medicine. My primary research interest is in bariatric surgery, particularly the application of bariatric surgery to the treatment of diabetes and diabetic complications. And in that regard, I have a special interest in experimental models of diabetic kidney disease and the effect of gastric bypass particularly. I think that the treatment of obesity with bariatric surgery has a lot of effects beyond weight loss, so is increasingly being termed metabolic surgery due to its effect on diabetes, and of course if it has effects on diabetes it can have effects on the end organ complications of diabetes. So there's much potential benefit to be accrued from the use of bariatric surgery in patients with diabetic complications, but with due regard to some of the complications that can arise with surgery itself. The future of surgery, I think, will be moving towards, in this field there's a lot of focus on trying to replace elements of the gastric bypass with medical device driven effects, because much of the physiology of gastric bypass is accounted for by elements such as exclusion of the duodenum, something that can be replicated endoscopically. Also, the future of bariatric surgery, as more and more people are having this surgery to treat end organ damage or complications, there's also a need probably to put a focus on mitigating the negative repercussions of surgery in relation to vitamin D action, iron malabsorption, etc. Well, I myself am not a surgeon, so I'm a researcher, but I've trained a lot of surgeons actually in the laboratory. So having a good grounding in a good laboratory to undertake your MD or PhD studies, and probably I would say the best experience is to do all of your basic surgical training first and then do research. That's where I've seen the best outcomes for my students. Take-home message is that gastric bypass can be used to treat the renal complications of diabetes, and there are potentially mechanisms by which those benefits could be replicated non-surgically.
Great, thank you for your time.
Thank you.